Welcome to my Clearwater Community Assessment by Dana Cooper. History of Clearwater. Clearwater was originally called Clearwater Harbor because of the clear springs that used to flow into the bay where downtown is now located. The railroad had reached this area by 1888 and there were 18 families living here. There was farming for vegetables, cotton, and fishing. The creation of Pinellas County occurred in 1912, and the creation of the city of Clearwater occurred in 1915. There was steady growth and a land boom from 1921 to 1925. The Great Depression happened after this, affecting this area and the entire country. In 1950, there were 15,000 residents, and it has grown to the 115,000 residents who make Clearwater their home. The city of Clearwater's boundaries extend east to west from the Tampa Bay to the Gulf of Mexico along Route 60. The northern boundary extends to Route 586 and the southern boundary to East Bay Drive. Structure of Clearwater. There are over 59,000 housing units in Clearwater, with 62% being owned and the remaining 38% being rented. 14.7% of that housing does remain vacant, so there is not a housing shortage in Clearwater. There are an abundance of places to worship for those of the Christian faith, with all major denominations represented in the city. There are 2 mosques near Clearwater, but not in the city limits. There are 2 synagogues within the city limits. Transportation mostly relies on individuals driving themselves, with the majority of households owning 2 cars. Most of the roads are paved and in good driving condition, although there is a fair amount of traffic. Improvement projects are in the works to help with traffic flow. There are grocery stores within a few minutes drive time for the majority of residents, including a Walmart neighborhood store and Super Walmart that are open 24 hours. There are also many pharmacies available, many of which are also open 24 hours. The price of medications are very dependent on whether the resident has insurance. Population of Clearwater. The city of Clearwater is more densely populated than the rest of the county and state, but it is a metropolitan area. Although the unemployment rate is below state averages, the poverty level is actually above state and national average, which is a definite area for improvement. The overall education rate is close to equal with surrounding areas. The death rate is higher than the birth rate for Pinellas County. This is probably in relationship to the average age of residents being slightly higher than the rest of the state. Population needs and health concerns. The things that I think the population of Clearwater needs the most is a smoking cessation program, better skin cancer awareness, and obesity prevention and treatment. Heart disease and cancer are the leading causes of death for Clearwater, which are related to these risk factors. Smoking cessation. Smoking has a huge impact on the risk of chronic diseases such as heart disease, hypertension, diabetes, and cancer. Smoking is extremely difficult to give up independently. Research has shown that quit hotlines and community programs increase the amount of people quitting and decrease the amount of people who start smoking again. Skin cancer awareness. Skin cancer is actually the most common cancer in the United States. 20% of Americans will develop skin cancer at some point in their lifetimes. Melanoma is on the rise, and the most effective treatment is prevention. Residents of the Clearwater community are at high risk due to the nice weather and popular outdoor activities. Prevention programs have been rolled out in Australia with great success, preventing thousands of skin cancer diagnoses and deaths. Obesity awareness and prevention. A lifestyle that is low in exercise and high in excess calories leads to an increased risk of chronic diseases that can be avoided. Almost 30% of the community is overweight or obese. Obesity rates in children continue to be on the rise. Those below the poverty line have increased obesity rates. Adequacy of health-related resources. Access. There are enough health-related resources. Acceptability. There is a wide variety of health-related resources. Affordability. They are not all necessarily affordable, Without health insurance, residents would have trouble paying for all their medical needs. On average, 83% of people in this country have medical insurance. The goal would be for that number to increase to 100% so that people can get the care they need no matter the cost. Clearwater is below the national average with only 79.2% insured residents. This has a huge impact on the cost of health care for those people and others in the community. This puts a stress on limited free resources in the community. Healthy community objectives. There are many Healthy People 2020 objectives that are applicable to the Clearwater community, but the top 3 are: 1. Decrease the amount of new cancer cases and increase early detection through prevention and screenings. 2. Increase those that maintain a healthy diet and healthy weight. 3. Decrease smoking and the effects of tobacco use and secondhand smoke. Clearwater environment. The city is a beautiful place to live, filled with green, lush landscape, blue water, blue skies, and pink sunsets. Environmental benefits. There are many environmental benefits to living in Clearwater. The sanitation, waste, and water services are more than adequate. There is a recycling program that ranks one of the best in the state. There are plentiful and well-maintained parks and areas for indoor and outdoor recreation. The police and fire rescue respond in above national average time frames. Most residents consider Clearwater a safe place to live. The city, county, and state all have well-established disaster planning. The overall air quality is above average compared to other metropolitan areas in the country. Environmental risks. Unfortunately, there are some drawbacks to living in such a beautiful place. Although Pinellas County treats regularly for mosquitoes and residents are educated on how to avoid making their population worse, it still poses a risk for disease such as West Nile and the Zika virus. Flooding and groundwater contamination are always a risk in Clearwater and the entire state due to its location and that is surrounded by water. Clearwater government and public policy. The positive aspects of Clearwater's government include: government officials are elected by the residents, all 5 council members have an equal vote in policy decisions, budget is accounted for and easy for all residents to access. Clearwater government needs. Council members are majority white males. More diversity would be beneficial. Many of the members ran unopposed, which does not give the residents options in their officials. The community needs to be more invested and involved in policies and issues. Although council meetings are posted, they are not well attended and outreach from officials is low. In closing, overall community needs include smoking cessation programs and incentives. Due to the negative consequences it has on health and others in the community. 2. Eating healthy and maintaining a healthy weight, because of the positive benefits it has on overall health and the overall health of the community. 3. Decreasing risk of cancer, including sun safety and early detection screenings. Cancer is one of the leading causes of death for Clearwater. These things can help prevent them. 4. Mental health screenings more readily available. Even if people have access to health care, oftentimes their mental health needs are overlooked. There is an increasing concern in the community for young adult suicides and violence to others. 5. Primary prevention health care. So much of health care is reactive instead of proactive. Primary prevention can be the key to avoiding disease altogether. 6. Personal and household disaster planning. Although Clearwater and Pinellas County have a detailed disaster plan in place and have easily accessible information on how to plan for these disasters, few residents actually have a plan in place or supplies in case of disaster. Thank you so much for listening. I hope you enjoyed my program.